Hi, this is DrRic. Today's tutorial is on TENS units. Anyone who comes in to see me for any kind of back pain, muscle pain, body ache, joint pain will usually know that I love to prescribe TENS units. I think it's a nice modality to facilitate the healing process. Just like the anti-inflammatory lifestyle, what we do is try to compress the time frame of healing. With an injury or a disease like rheumatoid arthritis or fibromyalgia, muscle, bone, tendon, and ligament are always involved in some form of inflammation. When you have an injury, inflammation is normal. When you don't have an injury, such as those who suffer from fibromyalgia but just have muscle spasm trigger points, there isn't necessarily a tear or a trauma or a contusion to muscle, but it's sometimes with enough overuse will start to fail, and that's sort of the beginning of a trigger point. But again, regardless of whether you have an injury or you have a pre-existing disease that exposes you to spasm and pain, a TENS unit is used to facilitate healing. Modalities of any sort are important in physical therapy. Modality like heat, ice, electric stimulation, ultrasound. This is electric stimulation. TENS unit stands for transcutaneous electronic nerve stimulation, and I'll put it down here. When you have this modality in the physical therapy department, it feels pretty decent, it feels good. Actually, at UCLA, we learned with medical acupuncture to also use a TENS unit connected to the certain needles in acupuncture to stimulate or speed up the healing process. In traditional Chinese medicine, acupuncture and electricity is used together to not necessarily take care of or stimulate, speed up the healing process. It's to move energy. I'll get into that later, or you can look into my What is Alternative Medicine video and learn more about acupuncture. But for today's discussion, we're going to discuss the TENS unit. So when you have, for example, muscle strain. Say you have a tennis elbow, which is lateral epicondylitis. Just in using this pathology, lateral epicondylitis or tennis elbow is when the muscles that extend the forearm and the wrist are injured. So usually most people have pain right to the lateral epicondyle, or what is known in backhand tennis players as painful. And so when there's irritation or muscle spasm here, usually what you do is you rest the area and the body rebuilds and takes care of itself. And that's fine. When you add a TENS unit and electric stimulation, this is a sticky pad. So the two sticky pads that we use are negative and positive. You put one at the area distal to the injury. You put one at the area proximal to the injury. And the electricity travels in a way that it goes from positive to negative. Or it can actually, you can change it and go from negative to positive too, but regardless, we ask the electricity to conduct in one direction. When it does that, it'll actually cause a wave of contraction. And the wave of contraction will cause muscle spasm or muscle contraction, and with muscle contraction and then relaxation, you actually have the pumping of blood into the area. So not only do you have the muscle getting more blood flow to the area that's injured, thus facilitating healing, you also have this movement of muscle. And anybody who's been in a cast or been injured and having to keep an arm in a sling or a leg in immobilized in crutches, your muscle, when you don't move it, becomes atrophic. It's studied that usually after about a week of immobilization, even the quadriceps femoris, the quad muscles, can decrease their strength by about 20%. So it's nice when you're injured to get a little bit of exercise. And obviously it's not going to be like working out or performing your usual exercises, but it's better than nothing. And again, it works to facilitate blood flow. Most folks who I've done electric or medical acupuncture on and use electricity will actually feel really relaxed afterward too, because when you use electricity to move muscle and move blood, and in traditional Chinese medicine move energy, it will release hormones. It'll release endorphins, and those of you who exercise and know that runner's high or the exercise high you get after exercise, you feel pretty good for about half an hour to 2 hours. That's because the hormones that are released are circulating and continuing to circulate around. Thus the benefits of exercise for lowering blood pressure, calming down anxiety and other things. But in this case, when you use electricity, the TENS unit, when you go to the physical therapist, it just again facilitates healing. And that, I just wanted to explain the concept of why if you leave my office and you wonder why I'm using or ordering a TENS unit, why I like to give prescriptions for TENS units. Which brings me to the next idea. The TENS unit, I don't keep them in my office, and most physical therapists have their own unit in the physical therapy center. Most of the time you see me once a month, you see the physical therapist 2 to 3 times a week. I like when my patients have TENS units at home. I see a lot of UPS and FedEx drivers, and they're in the truck for hours at a time driving. And when you have back pain, not necessarily an injury, but when you have back pain from driving and you continue to drive, it feels kind of good when you get out and stretch every once in a while. Well, a portable TENS unit can also be given. Depends on the company that I'm sending it to or that I'm having the TENS unit ordered from. If they have just electronic boxes, then we're out of luck. If you can get one that has a portable box, you just actually clip this on your belt, and you just put the electronic line or the electric lines, which low voltage, low amperage, doesn't cause any pain. You put them tucked away underneath the clothing, and you get the pads and you stick them on wherever your pain is. Again, if it was a forearm injury, I showed you that. If it's back pain, you kind of put them above and below the muscles that are spasmed. And you just, nobody even knows it, but you just keep on getting the electric stimulation. Technically, there is no side effects to the TENS unit. There was a study back in the 90s that said people who use TENS units tend to be addicted to the TENS unit. I don't like the word in the study that said addicted. I think that like having an affinity to want to use the TENS unit over and over again, it's kind of like exercise. You don't necessarily say exercise is an addiction. It sometimes makes you want to come back to it because of the great benefits. Well, there is, because of the endorphin release, there is a great want to use this all the time, but it's such a, you do have to kind of put this pads on, you have to clip the thing on, and you have to do a ritual. So I don't think any of my patients become addicted to this, so I don't think you have to get worried. But aside from that, aside from liking the results of the TENS unit, there might be a price problem if your insurance doesn't cover it, but you can find them online. A patient of mine couldn't get the box from the people that we use, so he was going to do a search, and I searched yesterday, and there are some units used that are pretty cheap, $50 to $100. So regardless, don't forget that when we do order a TENS unit and you do get some good results with compressing the time frame of your healing, it's still important to have mobility, to have someone show you exercises to develop the muscle and strengthen it so it doesn't happen again. And also other exercises to take care of the joint above and below that might be going through some extra work while the primary joint is injured and rehabbing. I always say that it's important to involve nutrition and relaxation, as usual, with my anti-inflammatory lifestyle change. It not only will help with keeping you alive till 90, but it also helps in these times when you injure yourself. It compresses the time frame of the injury. And for my fibromyalgia sufferers out there, even if you're not injured and you just have a flare-up of back spasm, most of my fibromyalgia sufferers have trapezius back spasm and then numbness and tingling into the arm or into the head. If you have a flare-up because of emotional turmoil, because of holidays, because of stress from work, this also is fantastic because, again, you can use it at work. So those of you who have fibromyalgia and are at a computer terminal for 13 hours a day and then trying to deal with spasm, a nice way to take care of that spasm is to get a new job. But all joking aside, a nice way to take care of the spasm if you can't get rid of your job is to use one of these and participate in a good diet and a good activity.